Welcome back, friends. So in this session we are continuing the osteology of lower limb. We already started hip bone, and this is the last part of hip bone, that is pubis. So let us finish this part. The next part I will be doing a small part of the hip bone like acetabulum, obturator foramen, and some applied aspect. So let us begin. Let's learn the osteology of pubis. So let us begin the photos. Let me get our green bone, what photo we are using from Netta. Okay, so pubis. So what does exactly pubis mean? So pubis means it is a bone related to groin. So you know what is a groin? Groin is an area between the thighs. So this is the part which comes, if you see the skeleton, you will find that this is the part which will come in between your groin region. So that is why it is called as a between the thigh region. That is why the thigh region portion is what we call as a area between two medial aspect of thigh is what we call groin. So a bone related to groin is literally meaning of pubis in Latin. Now this particular bone, so this is anterior and here is a posterior. This is superior and this is inferior. So we know this bone is forming here, this bone here, what we are saying, the red color bone. It forms your antero inferior part of hip bone, and we know it is contributing to the formation of your acetabulum also. So it is contributing to the antero-inferior 1/5 of acetabulum. So it forms antero-inferior 1/5 of acetabulum. Now parts of bone. So again, let me bring the picture again. So okay, so this goes the bone again here. So what are the parts of pubis? Now, pubis has got three parts. It has got body, it has got two. So the body is this portion, which is in this, it is difficult to show, but I'll show you on the app also. This is your body, and this is an inferior projection from body, and this is a superior projection from body. This entire thing is body. So this projection which is going up, this we call as the superior ramus. This projection coming down is called the inferior ramus. Let's go two ramus, unlike ischium which has only one ramus. So superior ramus of ramus is a bifurcation, a branch. Inferior ramus, a horn. Okay, so these are your three parts are there. We'll do in detail about each part. So as far as the location of all these three parts are concerned, here the location of your body. So body is located anteriorly, and whereas superior ramus is located superolaterally from the body, and this is located here inferolaterally. So if I draw this, this is a body. So from the body, this is the anterior location. This is superiorly but going lateral. The same way it coming down, inferior ramus. So this one is inferiorly and laterally. So your body lies anteriorly, whereas the superior ramus lies superolaterally, inferior ramus lies infrolaterally. So these are your, so this side will be another body. These are your two rami on the either side. So that's your location of these three parts. Now let us go to the details of the body. So again, let me bring the picture. I need the other picture also. That is the medial view. Both view will need it. Okay, this is taking most of my space, but okay, now so we are doing the body of pubis. Body of pubis, we said the location is, it is located anteriorly. It is the one when we stand in anatomical position, it is a flat bone lying anteriorly. So this is the body on the, this one is a medial surface medially, and this one is a lateral view. So in both the cases, this is our body, the center part, this piece is our body. Here also we can see this is the body. So in the app, when I show you will follow better. So I told you location is anteriorly and it is a flat bone among all the three part. Now this has got border. It has got a border. Yeah, there is only one border is there to the body, and that border is called superior border. Now the superior border is, this is the border here I am drawing. This projection is superior border, or this projection. Or I can show one more image. Yeah. So in this location you can see it is pubis is here, and this is on superior surface. This is extra projection, what you are seeing, this one. This is what we call as your superior border of the body of pubis. And the superior border also known as, so this border is called superior border. This is also known as, it is called as a pubic crest. Just like a iliac crest, we have a crest for the pubis also. So a better picture for this, maybe I can bring it. So okay, so let me bring a better picture from the netter. Now this is lower limb. Now we won't find this picture, I think, in lower limb. Let us get the picture. Yeah, from here I can get. So now this is the picture. Let us open this in our app. Okay. Now this is the anterior-most bone. Here we can see anatomical position, and in this position, let me show you again a different part. So which is body. So here this portion, the entire thing, whatever if I am putting down here, this entire piece is body on both the side. Let me rub it and again make it one more time. So this is body on this side. These two are the bodies, right and left bodies of your pubis. And from here you have an extension. If I use a different color, this extension, what you're seeing going up, and this extension is your superior ramus on both the side. This is your superior ramus, and here the view is not clear, but the one which is going downward till here. Now this is what is our inferior ramus. As I told you in the description, the body is lying anteriorly, whereas superior ramus is superiorly and laterally, and inferior ramus is inferiorly and laterally. We started doing the body. So we are doing the body here now. So in the body we mentioned that there is only one border is there in the body, and that border is called as a superior border. A superior border is also known as, it is like a crest. So you have an iliac crest here. This is what we call iliac crest. It's a rough platform extending from anterior iliac spine to the posterior. Same way here also we have a crest. This is called pubic crest, also called superior border. Here you call iliac crest as the upper end, or superior end. So here this projection what you are seeing, this one, if I am noting down here, this entire projection what you can make out, this projection is what we call as a here pubic crest. In this pubic crest, this lateral part which I am shading right now, lateral edge of the pubic crest, because this is the midline and this is your lateral on both sides. So this lateral projection which I am shading right now, or I can call the lateral end of the pubic crest. So your lateral end of pubic crest has a name. Now this is what we call it. It's slightly elevated, so it is called as a pubic tubercle. It's important. Can be asked in the exam again. So what is a pubic tubercle? Pubic tubercle is an elevation seen in the superior border. So what is the superior border? It is a pubic crest. So it is a lateral end of the pubic crest. And what is a pubic crest? It is a superior border of body of the pubis. So this is how you will demarcate your pubic tubercle. Now body has got, so thereby, so we are doing the body of pubis. So body of pubis has got only one border, and that border we are calling as a superior border, which we are now also known as pubic crest. And we know the lateral end of this pubic crest is called as a pubic tubercle. This you have to know it. Okay, so this is one part of the body. Now there are no other borders, only one border is it. The remaining thing what we have with this is surfaces. So there are surfaces in the body, and there are three surfaces are there. So the surfaces are, you got anterior surface, posterior surface, and medial surface. So these are three surfaces what we have. This posterior surface is also known as pelvic surface because it is forming your wall of the pelvis. Medial surface is also called as a symphyseal surface. Now let me show you these surfaces in this image. I think yeah, I can take the image from here. So okay, so surfaces of body of pubis. First is the anterior surface. Anterior surface, this surface is all is your anterior, whatever the surface which you are seeing in atypical position. You take this image also, keep it here, and this surface what we are noticing, this is your anterior surface. This one, whatever is in front, which is facing you and me, that is the anterior surface of the body. And second surface is your posterior surface. I told posterior surface is also called as a pelvic surface. Now pelvic surface, so it is here. In this case it will be right behind. This is the, in this case, this diagram, these are your pelvic surfaces. So in this picture we can't see, so I'll bring the other image. Yeah, this image we can put here. Now this is the inner side we are seeing. Now this surface here, this is your posterior or pelvic surface, back side of it, whole of that. And here which is hidden here is your anterior surface, which we have seen in the Yes, now. And there is a third surface called medial surface. Now, medial surface is also called symphyseal surface because it forms a pubic symphysis with the opposite. So this is your medial surface, right? And again, if you bring this image, so in this image, your medial surface will be, if you take a blade and cut this, and look at on this side and this side, these are your medial surfaces. So these are your three surfaces are there. So if you look at the features of these surface, your anterior surfaces, most of it is rough. Anterior surfaces, most of it is rough. Only a small portion will be smooth, whereas your pelvic or posterior surfaces, it is smooth, and it forms your anterior wall of true pelvis. So this is your anterior wall of true pelvis, these are your lateral wall of true pelvis, and this is the posterior wall of true pelvis. So that way it is forming your anterior wall of true pelvis. Medial surface, it is articular, we can say. Medial surface is articular, and it articulates with the opposite side medial surface to form a secondary cartilaginous joint, that is pubic symphysis. And this is secondary cartilaginous joint. Medial surface, which is the pelvic surface, here inside we have the viscera, so it is related to your urinary bladder. Yeah, so I was talking about the surfaces of the body of pubis. There are three surfaces are there. One is the anterior surface, which is, this is the anterior surface which I am shading on both the sides. Then there is a posterior surface. This is the posterior surface already shown here in the back, and here by arrow I am showing. It is forming the part of the anterior wall of the true pelvis, and it is also related to the urinary bladder in both male and female. Medial surface is this surface where I have drawn a line. This is a medial surface, and it is articular surface. It articulates with the medial surface of opposite side to form a pubic symphysis, which is a secondary cartilaginous joint. So now let us see these three surfaces of the body in the app. Okay, so on this image as it is, so use the pen. Now this is your body on both the side, and this is your superior ramus, and this is your inferior ramus. Now what we need is, I'll remove one side of the bone, and let us remove the vertebrae also. Sorry. So this will make our model less crowded. Okay. Now this should help us to see all the borders and surfaces. Okay, so this is right pubis. Now where is the body and where is the surface? Now you can see in this particular diagram, you will be able to differentiate. Now when I put on this, you can see now this one is the pink. This is your body. You can see on the top, and you can see on your left side. So the pink marked area is the body. So I am turning it. You can see this is your anterior view of body, this is superior view, this is a medial view, and this is the posterior view. So thereby, so this view when we are seeing this one, so this is our anterior surface of your body. Anterior surface. So let me write down this. On the A I will write this is the anterior surface of the body. So now if I turn this now, this one back side, here again sacrum is coming in between, so maybe I can hide the sacrum also. Yeah, so we have hidden the sacrum. Let us hide. Okay, so now this one, either posterior surface P or the pelvic surface, and one more surface we need now, and that surface will be, again see here, anterior surface here, posterior surface of pelvic surface here, and this surface I can write down now here, M. These are your three surfaces: your anterior surface of the body, medial surface of the body, and posterior surface of the body. Medial surface is also called symphyseal surface because with the other pubic bone it is forming a joint. This is called as a pelvic surface because it is forming the true pelvis, and that's your anterior surface. So these are the three surfaces what we have. And then I also mentioned something about the pubic tubercle, so and pubic crust. So what is pubic tubercle and what is pubic crust? So on the superior surface here, if you see here, you can make out on this area, this entire is here, this entire part is your superior border, also called as a pubic crest. This slight elevated area here, the lateral end, that is your pubic crest. So this is your part. So I think the parts are clear now. So you now know the body. So this is all about body. So now let us go to the next part again. Let us talk about, so body surfaces of the body are over. Now we'll go to the ramus. So let us talk about our superior ramus first. Superior ramus of pubis. A superior ramus of pubis. So in this picture again, so if I put this picture, this is the medial view, and this is the superior ramus. This is their body, and this is our inferior ramus. A superior ramus of pubis. Now I already told you the location is, it is located superiorly and laterally. So it is located superolaterally from the body of pubis, and extent, it's a piece of bone, vertical piece of bone. So it is extending from the body of pubis. Here you can see from all the way it is going till your acetabulum. So here acetabulum you can't see, maybe I can show you the other side, maybe that time we can see the acetabulum also. Now this image will be helpful. So now you can see here, so that's our superior ramus, and this is the body. So you can say that it is extending from the body all the way till your acetabulum. So this entire piece what you are seeing is the superior ramus. So extent is from body of pubis till acetabulum, above the obturator margin. It has got, superior ramus has got borders and surfaces. Just like your body, there was only one border and there were three surfaces. Here you have three borders and three surfaces. So let me put down the borders now. So there are three borders are there: superior border, anterior border, and inferior border. A superior border is also known as, the other name is pecten pubis, or it is also called as a pectinate line. This is important, you have to remember this. And extent, if you look at this, what are these extent of this? In the app I will show you all the borders. It extends from superior border is a sharp crest. It extends from your pubic tubercle. You may remember the pubic tubercle. Maybe I can bring the image also here. Image will be of some help. Okay. So now in this, so it is extending from the pubic tubercle. So this is our pubic tubercle. That's your pubic tubercle. So from pubic tubercle the border is extending all the way. So it extends from the pubic tubercle till where? Till the iliopubic eminence. So here iliopubic eminence is on this side. So again I have to go and bring the other image. Yeah, this is the one which is better. So remember, it is extending from pubic tubercle to the your iliopubic eminence. Now where is the pubic tubercle here? I told this is a pubic tubercle, and this one, you see, this one is entirely, this whole line is what we call iliopubic. So till here. So this is the part. So this is our border. This border we call superior border, or simply we can call this as a pecten pubis. Pecten pubis or pectinate line, superior border. It is like a crest. It's like a sharp crest we can feel on the bone. Now anterior border, it is also having another name. It is also called as a obturator crest. And this extends from the pubic tubercle again. Pubic tubercle all the way till the acetabular notch. So for this I will need a acetabulum, so I have to go to the lateral image again. So let us bring the lateral image. So that's the lateral image. So again, now this is the pubic tubercle again, and this is this gap what you see. This is your acetabulum, and this inferior gap is what we call as a notch of acetabulum. So this border is extending, you can see, from the pubic tubercle till your acetabular notch, which is the gap. This gap is a notch. So that is your anterior border, and it is also called as a crest of obturator or obturator crest. And third is your inferior border. Now, inferior border compared to the remaining. So anterior border is round, superior border is like a crest, and inferior border is sharpest of all, sharp border. Now this is forming, so inferior border again, this one is the inferior border. So I have to go to the other view. It forms a margin of your obturator foramen. This image again. So this border which I am showing now, this entire border what you are seeing, this one is your inferior border. It forms the margin of your obturator foramen. So inferior border. So this is the superior border, also called as a pecten pubis, and some part here you can see this is some part of your anterior border, but anterior border will be seen on the other side. So these are your three borders. So let us see these borders again in the application. So okay, so again I have to remove one side of the bone, hide it. Okay, now here we know this is in this picture. If you want me, I can draw it for you. Okay, so let us draw the now this border which I am drawing from the pubic tubercle to this. So this border is our pubic crest. This is to the notch. So this should be your anterior border. See, this is your anterior surface is here, anterior surface of body. So this is the anterior surface of body. This is your anterior border of the superior ramus. Now if I turn this, you see there is one more on the top if I see, and I'll draw a line again. Now this one again from the pubic tubercle, you have this border which is extending down till here. That is, the green line is the end of your ramus. So that one is your superior border, also called as a pecten pubis. That is your superior. Okay. Now if I turn this, and you see one more border there now. So that border, what you are noticing, sorry, so this border is your inferior border. So if you see all the borders again, so this is your anterior border extending from the pubic tubercle to the acetabular notch. This is your superior border extending from the pubic tubercle to the iliopubic eminence. This is the superior border or pecten pubis. This one is your inferior border. This is sharp border, and it is forming the, you can see here, if you see from the side, margin of, you can see here, margin of your obturator. Yeah, so that's your inferior. Here also you can see the inferior border from this side and from this side. Okay, so I will now show you here also again. Now this particular colorful image will give us the border again. So whenever I am touching, it will show the name of the border. Now you see this is, this one is your obturator crest, which is nothing but other name of your anterior border. So this is our anterior border. You can see that's your anterior border from pubic tubercle to the acetabular notch. Now I am touching the superior border. This is also called as a pecten pubis, again from the pubic tubercle to your iliopubic eminence. And here I can touch this one. So yeah, this is our inferior border. You can see this is the inferior border. So this side you can see, and inside also you can see. So that's the inferior border, right? So inferior border. I will try doing multi-selection. Here it doesn't work, I think. Okay. Anyways, so you got your inferior border, and your, one second, this is okay. So what were our border? Let us again color it. Okay, this bone I have to hide again, so let us hide the bone. Okay, so again one more time, this is our obturator crest or anterior border, this is our superior border of pecten pubis, and this one is our inferior border, which is the sharpest of all the border, forming the margin of obturator foramen. So these are your three borders, right? So let us go now back. So now we know that superior ramus has how many borders? Three borders are there. Superior border, here is the superior border, anterior border is another image, inferior border, which we are seeing inferior. Now I also told that the superior ramus also has surfaces. It has got surfaces. There are three surfaces are there. These surfaces are between the border which I just mentioned. So there is a pectineal surface, there is a pelvic surface, and there is a obturator surface. Now I'll bring the image again. So let us try to see in this, and then we'll go to the app. It's just a double revision of what we had seen. So okay, so this image if you put here, so now Here we said this border was a superior border, and down we said this one was the inferior border, and between your superior border and inferior border you got your very smooth surface, and this definitely this we call pelvic surface because it is forming the pelvic wall. This is the pelvic surface what we have. Now between your anterior border and the superior border, so which is, I have to go to the other image on the other side. So this one was our anterior border, and this is our inferior border. So this surface what you are seeing here, the surface is your inferior surface. Here it is very difficult to make out, but when we go to the app we'll be able to see. So that is your inferior surface, or you can possibly call as a obturator surface. That is forming your obturator for an obturator surface, and this part is your pectineal surface because that is, you got a pectineal line. So here this one is your superior border. This is your superior border or pectineal line. This one is your anterior border or obturator crest. In between them you got your pectineal surface. That is your pectineal surface, the obturator surface. One more. So thereby I can say pectineal surface is a triangular area. You can see it is more like a triangle. It's a triangular area. It is present between your anterior and superior border, and it also extends from your pubic tubercle till the iliopubic eminence, whereas the pelvic border, it is again smooth area, pelvic surface, and extend between your superior surface, superior and inferior border. Again in the app I'll show this also. Obturator, it is the one which is present between anterior and inferior border. This also have an obturator groove. Okay, let us see these three in the app now. So here you can see this surface which we are seeing on the top. I'll label it. Now the surface is your pectineal surface. So this is your pectineal surface, what you are seeing on the top. It is between, you can see on this side, this is your, and I am touching this. Okay, the tool is there. Okay, so this is your, so this is, yeah, this one is your anterior border. So here this is the anterior border, and this is your superior border. We call this as a pecten pubis. So between this you got pectineal surface. It's a triangular area extending between your pubic tubercle. There is a pubic tubercle till your iliopubic eminence. And then next is your pelvic surface. So pelvic surface is at the back. Now I will hide this guy. Somehow when I am hiding this, it is not totally going. Sorry. Oh, this time it is gone. Okay, so here we have again the surface. Now I am putting this one. So this is our pelvic surface. It's difficult to write here. I'll just write PEL. It's your pelvic surface. So again, this one was your pectineal surface, triangular area between your superior border on this side, superior border, and your anterior border. This one is your pelvic surface. It is between here. Again on the top you got the superior border, and down you have the inferior border. And then next is your obturator. So obturator is the surface what you are seeing. So this is your obturator. OBT. Clear three surfaces. So here we have the pelvic surface, this is the pectineal surface, and that's your obturator. Pelvic pectineal is between your anterior border, this is the anterior border and the superior border. Pelvic is between your superior border and inferior border, and obturator is between your anterior border and inferior border. Now obturator surface, if you notice here, this side, it is even presenting a groove. Here there is some mistake is there in this, because as per the text, so this groove what you are seeing, I will take a photo of this. In this, as per the app, what is happening is this area which I am marking right now, this is what we call as a obturator groove. So as per this application which I am using, this is a part of, you can see here, it is a part of your pelvic surface, which is actually wrong. So there is a mistake here. It is, the color should be, that means this color they should leave off. This should belong to your the other side. So that is, obturator groove is a part of your obturator surface. So I'll take the photo of the other view and show you where it should actually the color. So this is where it should be. So this where I was showing this part. So this color should, this obturator should go all the way inside, because obturator surface has obturator groove with it. So this finishes here 3 surfaces of the superior ramus. So now let us go to the, so we are done with the 3 surfaces. So I told you obturator, this also have obturator groove. Now let us talk about the inferior ramus of pubis. Now inferior ramus of the pubis is simple and easy, and I think we have already done this. And so if you are not sure, so I recommend again you people go through the ischium part. In ischium we have already done this. So this is your inferior ramus, what we are having. From the body, infralateral extension, inferior ramus. So inferior ramus is, it is an inferolateral extension from body, inferiorly and laterally, and as far as the extent is concerned, it is from the body, it is going all the way and it is meeting with the ramus of ischium. So thereby extent is from the body of pubis to the ramus of ischium. And what is the fate of it? It unites. So fate is unites with ramus of ischium to form conjoint ischiopubic. Conjoint ischiopubic rami. So this we have done in our pubic your ischium class. If you remember, superficially if I tell you that it has got an upper border, a lower border, outer surface, an inner surface, and inner surface is divided by 2 ridges into 3 areas. So the muscles attached to the upper border and the lower border, that is your obturator membrane, and the lower border is the fascia lata and the perineal membrane. And your outer surface also we mentioned about the muscles. The muscles being your adductor longus, gracilis, obturator externus, and adductor magnus on the outer surface. And on the inner surface, I mentioned from above downward, obturator internus, then there was a deep transverse perineal muscle, then perineal membrane, superficial transverse perineal muscle, ischiocavernosus. So these are all the things which we have seen in the previous class, right? So that's about your inferior ramus. So inferior ramus is already done with the conjoint ischiopubic rami. That is why we are not doing it in this part of it. This finishes here first part of the pubis. The next part of the pubis is about the attachment. So now we are doing pubis attachments and relations. So in this, first we start with the body of pubis. So here body of pubis, here we will talk about, there was an important part here. If you remember, there was something called as a pubic crest was there, and you also had pubic tubercle. If you remember, these two were the part of your superior border of your body. So that means, in other words, what we are doing, I can write down in the red color above. So we are doing the superior border. It is having only one border called superior border. Superior border is also known as pubic crest. The lateral end of the pubic crest is called as a pubic tubercle. So what are the structures which are attached or related to this? So first let us see what about the pubic crest. So pubic crest, again you can divide this into a medial part and the lateral part. So I'll put the diagram here, or maybe I'll make it small. Okay. So this one is our pubic, this portion we said as a pubic crest. And this can be divided into, towards us it is your medial and this one is your lateral. So medial and the lateral part. So here medial part is concerned, so medial part is crossed by, so here it is crossed by your medial head of rectus abdominis. You know the ab muscle, rectus abdominis, so that is crossing this part, this area. In the ab you will get to know, so there is a muscle going up from here, and whereas the lateral part is actually giving origin, so this is actually giving origin, so this portion origin to two muscle. One is here lateral head of rectus abdominis and a rarely present muscle called as a pyramidalis. So pubic crest is related to or crossed by medial head of rectus abdominis in the medial part and the lateral part giving origin to rectus abdominis, lateral head and pyramidalis. So let us see these two things in the app and we'll come back. So now okay, now I will again remove one bone. Okay, so now we need pubic tubercle, and in the pubic tubercle, now the muscle we are talking. So let me put down the muscle here. So there is a rectus abdominis, right, and is another muscle, pyramidalis, right. Okay, now look at this. I think if I hide, or let us separate this muscle, isolate V. Now you see. Now here you can see that this muscle is your same muscle, rectus, the ab muscle, 6-pack or 4-pack muscle. And here you can see this muscle. Now this one, again there is some problem in this. So I'll take a picture of this and show went wrong. Why there is problem? Because this is only showing here, this is the medial head, whereas you see the lateral head is not showing. So lateral head also should come down here. So that is what we say, the lateral head is crossing the lateral part of the pubic crest, whereas the medial head is taking the origin. So that is your origin and this is the crossing part, lateral head. So this is one part of it. We also see, in addition to this, we are also seeing pyramidalis. So where is our pyramidalis? So if you see pyramidalis, the small tiny muscle here, if you notice, yeah, that's a muscle. Let's isolate. That's your pyramidalis, very small muscle. See here, and this muscle is also taking origin from your lateral part. I told you the medial part is crossed by the medial head, whereas the lateral part gives origin to lateral head of rectus abdominis and pyramidalis. So that's your pyramidalis. So in one word you can say, so if you come back to this back, so thereby you can say a medial part is crossed by, here medial part is crossed by a medial head of rectus abdominis, whereas the lateral part, so this is the lateral part where you are actually seeing here pyramidalis muscle. So there backside you see some gap is there. In that gap the lateral head should also come. So the lateral part of the pubic crest is giving origin to lateral head of rectus abdominis with the pyramidalis. So next, so we are done with the pubic crest. Now what about our pubic tubercle? Now pubic tubercle is an important 3-marker question. It is the lateral extension of your pubic crest and it gives attachment to a ligament, a muscle, and it has got relations. So the ligament is, it is giving attachment to your medial end of inguinal ligament. Remember the inguinal ligament? So lateral end was to the anterior iliac spine. So medial end of inguinal ligament is attached here. So muscles are your cremaster. We call the ascending loop of cremaster. Simply you can write a cremaster muscle. This muscle is again forming the wall of your spermatic cord and the scrotum. And relation, it is crossed by, in case of male it is, you can say it is crossed by spermatic cord. So I'll show all the 3 in males. So let us see these relations here. So we can hide this muscle now, we don't need, or I can go straight to, yeah, this is easy. Okay, now we are looking at inguinal ligament. So inguinal. So your inguinal ligament on the right side, yeah, that's inguinal ligament, and we also need a muscle. Muscle is your cremaster, right cremaster. Cremaster muscle right, and we need the spermatic cord. So the spermatic cord is not there, but I'll be able to get through by cutting indirect way. Internal spermatic fascia will give you the idea. Okay. Now, so now if you see this, one by one, if you see, first one we'll look at our ligament. So let's do the isolation. Now in this ligament you can see your medial end. So you can see medial end is a pubic tubercle where it is attached. So if you want me, I can take a, yeah, that's the end which I was telling, medial end. So this is, you see the pubic tubercle this side, this is giving attachment to your inguinal ligament. Now this also gives attachment downward. In other picture I will show, there will be muscle is going down like this around the spermatic cord. So these are we call as a ascending loop of your cremaster muscle, and it will be also on this side, you will see it will be related to your spermatic cord. So these are the 3 things we'll see now on this. So let us go back and see here. Now this one is the one, this is called cremaster muscle. Now you can see that's a cremaster muscle. Again, if you see, notice this pubic tubercle, so it is taking origin here from the pubic tubercle. Fine. So that's your cremastic muscle origin. And you also have, now this is a spermatic cord, you can say. Here is the internal spermatic fascia, because we don't have spermatic cord, but we know this is also relation here. So that's a spermatic cord which is also related to this part. So these are your relations of your pubic tubercle. So one ligament, one muscle, and one spermatic cord in male. Now that finishes your superior border of the pubis. So their superior border is done. So your body of pubis also has, apart from the border which we call superior border, which is your pecten pubis, also called as a pubic crest. We have done the pubic crest, and in its lateral part we have done the pubic tubercle. So this one is done, but apart from border, the body is also having surfaces. So it has got 3 surfaces, out of which, remember the surfaces were your anterior surface, posterior surface, and medial surface. So anterior surface, then posterior surface, and medial surface. Now, anterior surface, it is again related to ligament. So there is a ligament called as an anterior pubic ligament. It is a ligament which is actually covering the anterior surface of pubic symphysis. It is also related to series of muscles. So many muscles are there in the anterior surface of body of pubis. So you got adductor longus, gracilis. These two muscles you have seen in the scheme also. This is a new muscle called adductor brevis, and there is a obturator externus. So these are your, so one ligament and 4 muscles are there. So let us see this, and then we'll come back to posterior surface. So again, I'll just remove everything. And let us separate one. Now what are we seeing? What we want now is the pubic ligament. So I said anterior pubic ligament to the surface, to the anterior surface of the body of the pubis. So anterior pubic ligament. Yeah, so that's your, you can see here, simple. It is a ligament which is covering your anterior surface of the pubic symphysis. Here in this view we can turn and I can show you. See, pubic symphysis anterior, it is forming the reinforcement of the capsule of your pubic symphysis joint. So next you also have, next are the muscles. There are 4 muscles are there. I'll put down all the muscles, then we'll see individually. Adductor longus, right, then we have gracilis, right, then we have adductor brevis, right, and finally obturator externus. Yeah, these are so many muscles we have. So let us see now. So I think we may have to remove our I have removed the anterior pubic ligament. Now I can remove this bone also, sacrum. This bone also will hide. Okay. Now first muscle I said is adductor longus. So this one is adductor longus. This is adductor longus. Let us see in the isolate view. Now you see, it if you look at the origin from the anterior surface, you see the anterior surface of the body. If you're still confused which is the anterior surface, you have to go back to my previous, this is a recorded session, please go back there and you will get to know. You see, it's a posterior surface of body of pubis. This is the anterior surface. So that's your anterior surface. We got our muscle, and then there is a gracilis, the long slender muscle, this one. Gracilis, and this also, you see, this also is coming from the anterior surface, but this is coming close to the margin of the pubic symphysis. It is very close to the origin, is close to the margin of pubic symphysis, whereas adductor longus was close to the pubic crest and pubic symphysis, you see. And then we have brevis muscle, small muscle in the background, that's a brevis. Now you see, again see, look at it, it is again coming more lateral. So medial most close to the pubic symphysis was the gracilis, then next was the adductor longus, then next to it you got the recta brevis, and more deeper to it we are reaching the margin of obturator foramen. So you will have your obturator externus, you can see now. So these are your, so what I can do is I can take a view of this and I can put down the other muscle name. So here we said, here we had a muscle, and that muscle was here gracilis. Then there was a muscle next to it here in this area, and that muscle was your adductor longus. And then next to it in this area there was another muscle, that was your adductor brevis. So this one, the entire thing what we are saying, this is our anterior surface of your body of pubis. So body of pubis gives rise to, this part is giving rise to your anterior pubic ligament, whereas the rest of the area is giving rise to muscle from the medial to lateral. Medial is gracilis, intermediate is your longus and brevis, and lateral most is your obturator externus. So this is here one of the surface, and that finishes your anterior surface of the body of pubis. The posterior surface is also called, if you remember, we also call this a pelvic surface because it is forming the part of your true pelvis. And this surface is also related to ligament. Here the ligament is pubo. Remember the puboprostatic, from the body of the pubis to the capsule of the prostate. So puboprostatic ligament. This is in case of male. Female will have a pubovesical urinary bladder, from the body of the pubis to the bladder. Pubovesical ligament in case of female. So they also have the ligament, and then the muscles. So here there are two muscles only. So you got levator ani. So this part is what we call as a pubococcygeus part of levator ani. In the medial part, the lateral part, you got your obturator internus muscle. So two muscle and one ligament, one in male, other in female. Let us see this now. So again, just to avoid all the crowd, I would like to remove everything, and so I'm just hiding it. Yeah. Okay. So now what we need is a ligament, that is pubo, on the pelvic surface. So pubo. So which surface? Let me show you one more time. This is the surface we are talking. With the pen, let me mark. This is the surface we are talking. Okay, so what are the structures which are attached to the surface? So you have muscle. you got a muscle. The muscles are there, two muscles we told. So medially you have a muscle levator ani, that is your pubococcygeus muscle, and laterally you have obturator internus. So here you will have, you can see here this, if I divide this into two parts, this is the medial part, so here this portion should give rise to your pubococcygeus levator ani, and this part is giving, you see this is obturator foramen, so this will give rise to your obturator internus. So okay. So now let us see here ligament puboprostate, right, puboprostatic ligament on the right. Female I am not searching, you will have the same name, same place, same ligament will be there. Puboprostatic. Next is the muscle, the levator ani. Sorry. Levator ani and obturator internus. Yeah, we are ready now. So let us see now. First, see your ligament. Now this is our ligament. Please notice the ligament, the small ligament, what you can see. That ligament is your puboprostatic ligament. If I isolate, you will get the idea. That's the ligament from the surface of the body of the pubis to the capsule of the prostate, puboprostatic ligament. Next is the same thing in female, you will have the pubovesical ligament. Next are the muscle. So there is a medial muscle and lateral muscle. Now you can see this is a medial muscle, there is a pubococcygeus part. You can see this muscle. So this is, you see, giving, or you can see from the medial or pelvic surface, you can see it is a rising medial part. Of course, the posterior part is not the part of this our concern, but the part which is shining is our part. Next is your obturator internus. You can see obturator internus also, some fibers are taking origin from the lateral part of pelvic surface. Yesterday we have seen this muscle in detail, if you remember. Yeah, okay. So this is here. The last surface here, here we got is here medial surface, and medial surface there is nothing, because we know medial surface form here joint, that is your pubic symphysis. So this surface is already taken care, you don't have any attachment. So this finishes here body of the pubis. Next we'll look at the ramus. Ramus of pubis, and we know in this ramus only superior ramus, because inferior ramus we have already done with the conjoined ischiopubic rami. So superior ramus, the pubis. So here we talk about the border first, and that first is a superior border. If you remember, superior border is also called as a pectineal line or pectin pubis. This is giving attachment again. Everyone, all these are giving ligament and muscle. So ligament here is your lacunar ligament of Cooper. This is the extension of your inguinal ligament. We have done this when I was doing. So lacunar ligament of Cooper. The medial end is attached to here. So medial end of your pectin pubis gives attachment to your lacunar ligament, and there is another ligament. This is just called lacunar ligament. Another ligament is there. It is called pectinate ligament of Cooper. This one. This is attached to the entire extent. When I show the diagram on the app, you will know it. And the muscle here is, remember the muscle by name conjoined tendon. Conjoined tendon is a common insertion of your internal oblique abdominis and your transverse abdominis. So these are your two. So conjoined tendon is one, you will see, and in addition to this you have one more muscle, that is your pectineus muscle. Pectineus muscle along with its fascia, pectineus fascia. And sometime if psoas minor is present, so then psoas minor if present. So now we are seeing the superior border of the superior ramus, where you have a ligament. Two ligaments are the lacunar ligament and pectinate ligament of Cooper, and three muscle, conjoint tendon, pectinate muscle with the fascia, and psoas minor if it is present. So let us see in this again. Okay. So what are the muscles we are seeing now? First the ligament, I told you. Ligament was your lacunar ligament. So lacunar ligament on the right side, this is one. Then we also need ligament of Cooper, that is a pectineal ligament. Two, and there were muscles were there. So we have a conjoint tendon, also called falx inguinalis, right side, and there was pectineus muscle in the fascia. And psoas minor if present. Okay, so we have all now. Let us see one by one each of this. First we start with the ligament. Ligament we said is your lacunar ligament. So that's your lacunar ligament. So I'll isolate so we'll see better. So that's your lacunar ligament. Remember we are doing the superior border, that upper line what you are seeing, that is the superior border of the ramus of the pubis on which this is attached. So we can see the medial end of the superior border. So if I take a screenshot here to tell you what I am doing. So this is all, this one is here superior border. So in this we are seeing the medial side. This is, it should come little, this is your medial part. So what is this ligament? This is your lacunar ligament. So there's another ligament is there which is called as a pectineal ligament of Cooper. So that ligament will attach the entire extent, all this totally. So that will be your pectineal ligament of Cooper. So let's see that now. We'll go back, and the other ligament in the background, and let's isolate. Now that's the ligament you see here, very thin margin. See this entire extent of your superior border or pecten pubis. So that's your attachment of your second ligament. And next is the muscle. So muscle is conjoint tendon. Now that's your conjoint tendon, again to the same border. You see, right, is called conjoint. You see, can you see there are two muscles are there here, one anterior and one posterior. This is anterior tendon is your internal oblique abdominis, and posterior tendon is your transverse abdominis. They both combine together and they are inserting onto the medial aspect of your superior border of the ramus of the pubis. And next is your pectineus muscle. Now you can see this is your pectineus muscle. Now this is also from the rest of the area, rest of your anterior border of your superior ramus is called the pecten pubis. That is why the muscle is also called as a pectinate muscle. And next we said, and this is covered by the same name, fascia also, which is not shown here. And next is your psoas minor if it is present. So now you see psoas minor taking origin from lumbar vertebra, but here you see it is coming. Here the insertion is little forward, should go back and should attach to that line. that is iliopubic eminence, which is the posterior extent of your superior border of superior ramus of the pubis. Fine. So this is all here. This finishes here superior border. Now there are other borders are there which we mentioned here. So if you remember the other border which we mentioned, so what were the other borders? So other borders were, in this case, where you're to the superior border you had anterior border, also called obturator crest, and inferior border. So you don't have any muscle or any other significant structure attached to it. So only one border as far as the attachment relations are concerned. And the next is here ramus of pubis, that is the superior ramus. We look in the surface. So surfaces, only one border varied, the other two border don't have any. So here the what were the other two border? This is one border. So other two border I told you. So other border is called as a your obturator was one more, and there was another one which we call this border as your pelvic. So these two border you don't have any attachments or relation. That is why we are not mentioning about these two border. Only superior border we have, so we did this. Now the surfaces are three. There is a pectineal surface. So borders where your superior border, anterior inferior border. Sorry, this is superior border. Then other border is your anterior border, and there was an inferior border. So this we don't have any either. That is the reason. So I'll just rub this. Other borders are, apart from superior border, you have anterior border and there's an inferior border. So here we don't have any much attachment or relation, so we are not mentioning about the other two borders of the superior ramus of pubis. Now the surface of pectineal surface, pelvic surface, and the obturator surface. Now as far as the pelvic surface is concerned, pectineal surface is concerned, it is not only from the pectineal border which we have seen, even from the surface also the muscle takes origin. So from the upper part of the surface we have this muscle taking origin. So pectineal muscle take origin from the superior border and from the pectineal surface. Pelvic surface forms a true pelvis wall. So thereby in male it is crossed by vas deferens, that is a tube which is carrying the spermatozoa, and in female is crossed by the round ligament of uterus. So obturator surface has got obturator groove. I told you the app was showing wrong, and these grooves allow transmit the same name. So you have the obturator nerve and vessel pass through this, and thereby they leave the pelvis and enter the lower limb. So this is the part. So let us see all these three surfaces in the app now. Okay. So pectineus, so again we can see pectineus muscle on the right. Okay, now you can see this muscle. So this muscle is, apart from taking origin from the border, it is also taking origin. So this is the surfaces are surfaces beneath it. So so the surface apart from the border. So here actually it is showing. So this is from border and surface, the pectineal muscle, and then next is a vas deferens. I told you. Vas deferens. So that's a vas deferens, and where it is relation you see here. What is vas deferens related to pelvic surface? So in this picture, if you want me to write down to show you the point out, so this is the area where it is related. So pelvic surface, your vas is rigid. Okay, so hope you remember what is a vas. Vas is, if you want, I can just show this vas clear. So this is the tube which is coming from the testes and going there all the way. Okay, next is, in case of female, it is the round ligament. So I'll show you the round ligament of uterus. So that's a round ligament of uterus. See here. So backside will be the uterus, and the front it came and it is merging with the labia majora. So in this case also, it is again the pelvic surface where it is coming. So here, if I have to show, this will be the area. So it is related to the pelvic surface. So pelvic surface is crossed by both round ligament of uterus in case of a female and vas deferens in case of a male, right? And we said there is a obturator, nerve obturator foramen, groove through which obturator nerves and vessels are going. So let us see that. Obturator, nerve, right, and obturator, artery. Right, then you have obturator nerve. So this is passing from the your obturator surface. Three things are there. I think nerve has not come. Obturator nerve is taken. Obturator vein I want. Obturator vein, right. Now you can see again one by one. First I'll select the nerve and isolate. You can see that's your obturator nerve passing through the groove. So here I can take a image to just to sorry. So this is our groove, obturator groove, through which this is your nerve, that is the obturator nerve. Same way you will find the artery and the vein also is passing through the same thing. So if I go back and show the individual, now let us see the artery. Artery is red in color. So I'll pick the artery, or let us do multi-select and see all three together. Not selecting, select only, multi-select, it's there. Okay, yeah, and one more. Why nerve is not selecting? Yeah, now let us isolate. Now you can see all three now. So they are all passing through your obturator groove, which is the obturator surface. Yeah, so I think that's clear enough. So we are doing the superior ramus of the pubis. There we are doing surfaces. Pectineal surface, I told you, is giving origin to pectineus muscle. Pelvic surface is in male, is crossed by vas deferens, and female, a round ligament of uterus. And your obturator surface, there you have obturator groove through which obturator nerves and vessels are leaving the pelvis and entering the lower limb. So what is left is a conjoined ischiopubic rami, which I have already done with the ramus of the ischium. So this finishes your pubis. Hope you have enjoyed this. If you have any questions, get back to me, guys.